65 years women, investigate a patient of abnormal uterine bleeding, presented with shortness of breath. Chest X-ray shows diffuse multiple varying-sized well-defined oval-shaped opacities involving both lungs without zonal predilection. Contrast CT chest, abdomen and pelvis done. Contrast CT chest shows diffuse multiple soft tissue density masses of varying sizes involving both lungs without zonal predilection. The masses are well-defined, rounded and show heterogeneous contrast enhancement. Some lesions abut the parietal pleura without definitive evidence of chest wall invasion. No bilateral pleural effusion, no mediastinal or hilar lymphadenopathies. CECT abdomen and pelvis show enlarged uterus, multiple heterogeneously enhancing well-defined intramural masses in the fundus and body of the uterus, similar large submucosal lesion distorting endometrial cavity. It is protruding through the internal os and form a mass within the cervical canal with dilatation of cervical canal. All lesions show no features of infiltration into the serosa and adjacent parametrium. Fat plain around uterus and cervix appears normal. Both adnexae appear normal with no adnexal masses. No ascites. No regional or para-aortic lymphadenopathies. No liver or spleen focal lesions. No suprarenal or adrenal mass. No major vascular thrombosis. No sinister bone lesions. Incidental finding of few simple cortical cysts in the both kidneys. Rest of the abdomen normal. Comments. Multiple heterogeneously enhancing lung masses are more in favor of secondary multiple metastatic deposits. Although rare pulmonary benign metastasizing leiomyoma cannot be excluded, multiple intramural and submucosal fibroids, extending into cervical canal. However, in presence of the multiple metastatic deposits in the both lungs, sarcomatous changes of fibroid has to be considered, suggest biopsy correlation of lung masses and uterine lesions. Discussion. Uterine leiomyosarcoma are malignant uterine tumors that arise from the myometrium. The uterus is the commonest location for a leiomyosarcoma. Typically, these tumors present in women in the 6th decade, most commonly, patients present with abnormal vaginal bleeding, pelvic mass and/or pelvic pain. Uncommonly, patients present with symptoms from local extension or metastases. The pattern of tumor spread is to the myometrium, pelvic blood vessels and lymphatics, contiguous pelvic structures, abdomen and then distantly, most often to the lungs. Radiographic features. The uterus is often massively enlarged. CT may show irregular central zones of low attenuation, suggesting extensive necrosis and hemorrhage, and foci of calcification may be present but rare. MRI shows an irregular margin of a uterine leiomyoma on MRI is suggestive of sarcomatous transformation. This is not considered that specific.